Hello, my name is Hunter Anderson. I'm a senior student in my undergraduate studies at Weber State University. I'm doing this presentation as part of my senior project. The lecture you're about to see will address some misconceptions that are common to introductory to psychology students. I hope you learned something new and that hopefully you'll be able to correct some of these common misconceptions. Thank you.
This presentation will address misconceptions surrounding suicide and electroconvulsive shock therapy. It will also help you to correct any misconceptions you may hold about these subjects. First, close your eyes for a moment and picture a suicidal person. What do you see? Chances are you imagine somebody who was deeply depressed. This could be a person that is sobbing uncontrollably. They might be unmotivated. They contemplate if their life is worth living. They give away many of their possessions and say that they're not worth being around. There is some truth in thinking depression is related to suicide. Major depressive disorder is a predictor of suicide attempts and completions. Individuals with major depressive disorder are at higher risk for suicide than individuals drawn from the general population. It is important to note, however, that the risk for suicide for individuals with major depressive disorder is 6%. This is much lower than the 15% that was originally accepted. While friends and family may think of depression as a passing phase or condition that can be overcome by increasing activity levels and positive thinking, it can be a life-threatening condition that should be taken seriously. While acknowledging the relationship between suicide and depression, problems arise when people assume that only depressed individuals commit suicide. Many studies have shown the prevalence of this exact belief. In a study with 331 undergraduate students in introductory to psychology courses, 43% of the students indicated that they believed that all individuals who commit suicide would be diagnosed as depressed. A follow-up study with 71 undergraduate majors found that 25% of the students endorsed this same belief. These findings are especially concerning when considering that an increased knowledge about depression and suicide should have debunked some of these misconceptions surrounding the subject. The belief that only clinically depressed individuals commit suicide is potentially dangerous. Friends, family, and significant others may erroneously assume that a person without depressive symptoms is safe and does not require immediate psychological attention. Research shows that 41% of individuals who commit suicide do not meet the diagnostic criteria for major depressive disorder. 10% of suicides are related to schizophrenia and substance abuse disorders. Other factors related to suicide include panic disorders, social phobias, borderline personality disorders, and gender identity disorder. It is important to note that many of these factors are comorbid, meaning that they occur with depression. Even though depression is often comorbid with the previously listed disorders, research has shown that many of these factors are important predictors of suicide by themselves. Remember that although depression has been linked to suicide, it is important to realize that depression is not the only or most important predictor of suicide. 5 to 10% of people who commit suicide have no diagnosable mental disorder. This has been termed rational suicide. Rational suicide is defined as a carefully considered decision to end one's own life in the face of terminal illness or untreatable pain. This is closely related to hopelessness, which research has found to be a better predictor of suicide than depression itself. Research also shows that while depression tends to decrease with age, the rates of suicide increase sharply in old age. Finally, research has found that suicide risk increases as depression lifts or decreases. This brings us to our next topic, which is electroconvulsive therapy, a legitimate treatment. Electroconvulsive therapy, more commonly known as shock therapy, is used in certain cases to treat individuals with severe depression. While this is true, most individuals view electroconvulsive therapy as physically dangerous, brutal, and inhumane. Close your eyes for a moment and imagine a typical electroconvulsive therapy session. What do you imagine? Chances are you pictured a patient being dragged into a room and strapped onto a bed. A rubber ball is shoved into the patient's mouth while probes are placed on their temples, and a powerful jolt of electric shock is administered. The patient convulses violently while being restrained and wakes up dazed, confused, with large chunks missing from their memory. They may even lose any sense of identity. Electroconvulsive therapy is the source of more misconceptions than any other psychological treatment. Many countries, such as the United States, Australia, and many European nations, regard electroconvulsive therapy as physically dangerous and psychologically harmful. This was demonstrated by a study that surveyed 200 Americans. Of those surveyed, 59% believed that electroconvulsive therapy is painful. 53% also said it induces nausea and vomiting. 42% stated that it was used to punish misbehaving patients and criminals. And 42% believed that electroconvulsive therapy destroys a large number of brain cells. Additionally, 16% of those surveyed believed that electroconvulsive therapy left patients in a comatose state. A similar study found that a large number of trained medical professionals endorsed these same beliefs. There are many factors that contribute to the misconceptions about electroconvulsive therapy. First of all, people who do not know very much about electroconvulsive therapy tend to view it unfavorably. Contributing to this unfavorable view is the fact that the early forms of electroconvulsive therapy were not safe. They often produced violent convulsions and occasionally resulted in broken bones, shattered teeth, and even death. While electroconvulsive therapy has changed considerably since its early forms, it is still associated with headaches, muscle aches, nausea, and memory loss. Individuals also assume that electroconvulsive therapy is dangerous because it involves passing electricity through a person's vein. Perhaps the most influential factor that contributes to the misconceptions surrounding electroconvulsive therapy is its inaccurate portrayal in the media. From 1948 to 2001, 22 films, including 2 that won Academy Awards as Best Picture, contained direct references to electroconvulsive therapy. These films often portray electroconvulsive therapy in a negative light. Examples from these films include the hospital staff administering electroconvulsive therapy to patients with criminal or antisocial behavior. In the films, electroconvulsive therapy is often depicted as being administered to fully conscious patients and leaving them in a comatose state or with them losing their own identity. Electroconvulsive therapy is much different in reality than it is in its media portrayals. Most individuals who receive electroconvulsive therapy suffer from severe depression. These individuals rely on electroconvulsive therapy when other procedures and treatments have failed to help them with their depression. Electroconvulsive therapy is a relatively safe procedure. The risk of death is about 2 to 10 individuals per 100,000 treatments. This risk is no higher than the risk from anesthesia alone. The procedure itself involves patients receiving a general anesthetic and a muscle relaxant. Occasionally, patients are given a substance, such as atropine, to block salivation. After the patient is unconscious, the physician then places electrodes on the patient's head and administers an electric shock, which induces a seizure lasting 45 to 60 seconds. Due to the anesthetic and muscle relaxant, the patient's movement is inhibited, which prevents them from harming themselves or others. In conclusion, misconceptions about electroconvulsive therapy and the relationship between suicide and depression are widespread throughout society. These misconceptions could be potentially harmful if they prevent individuals from receiving the help they need. It is important to remember that while there is a relationship between suicide and depression, depression is not the only or necessarily the most important predictor for suicide. It is also important to note that electroconvulsive therapy is not the brutal or inhumane treatment portrayed in the media. In reality, it is a relatively safe treatment option that has been found in some instances to be useful in treating individuals with severe depression. By understanding the truth about these topics, you are now in a better position to make informed decisions in your daily lives. I hope this presentation has been able to help you correct some of your misconceptions you may have held about suicide or electroconvulsive therapy. Thank you.